Hi, my name is Neeraj Jain, MD. I'm an interventional pain management specialist. I am the owner of Pinnacle Pain Management and Pinnacle Interventional Surgical Center. The procedure we're here to discuss today are called facet joint injections. So they're injections into the joint spaces that are formed by the two vertebral body or the bones in the spine. These are joints in the back of the spine that are like joints anywhere else in the body, knees, hips, shoulders. They allow for range of motion in the spine, meaning that they allow the spine to bend backwards, forwards, side to side, and rotational type activities. The injections are done in these joints to reduce inflammation and reduce the pain and allow physical therapy to work better to strengthen the back and the core. The facet joint injections are done in a sterile operating room setting, such as this. They involve having the patient being brought to the operating room. They're positioned on their stomach. Once they're positioned, full sterile prep is done to make sure or ensure that there's no risk of infection or very little risk of infection. We use special X-ray equipment that allows for verification of where we're going to put the needle and visualization of that area. The patient has local anesthetic. I put local anesthetic in the area where the needle is going to go, and then the needle is brought into the joint itself, again using the X-ray machine. We confirm the placement of the needle is in the joint by injecting a small amount of contrast or dye that we can visualize on the X-ray. Once the needle is optimally placed, then we would inject the medication. Typically, it's a steroid and a Novocaine-like local anesthetic. They may initially have some soreness as a result of the needles being put in through their skin, but over the time of a day or two, they'll notice improvement in their back pain and improvement in their function. We're happy that you chose to go ahead with your procedure, which we think will help with your pain. If you have any questions related to what happens prior to the procedure, during the procedure, or after the procedure, please feel free to ask.